Good evening. My name is David Knox, and I have multiple system atrophy. I'm back. It's been about a week. I feel much better. Um, had a bad 2 weeks, but a solid week of very bad asthma. Feeling good on lots of steroids. They're helping out. So my cough is pretty much gone. I still cough here and there, but feeling so much better. And I'm also back to sweating at nighttime, which is kind of weird. So I'm happy I'm sweating. Autonomic's doing pretty good. But I got a video for you today, and it speaks about RBD. And for RBD, we're talking about REM sleep behavior, or REM behavior disorder is what it stands for. It took me a while to find that out. That was on some of my medical documents. I'm like, what's RBD? Is it colors, red, blue, something? I don't know. And I want to read 3 paragraphs, and I got some videos for you. Interesting. I actually, I did some editing and did some shadows and some highlighting in the videos. I'm not trying to show the wife in the bedroom too much, but I have a camera to watch myself because I'm really interested in what I actually do at nighttime. And just in the last 5 days I've had this on, I am flabbergasted by what I see. So I'm going to show you what, REM behavior disorder looks like. So a couple of things here, 3 paragraphs. I'm kind of going to roll through the top 3, not the top one, but speaks about, this is an article from the National Institute of Health, right? What we think of Dr. Fauci and stuff, that's where we think of that. Sleep disorders are frequently seen in MSA populations. Some of these overlap across other Parkinsonisms, which is true, right? If you see this, usually it's Parkinson's, but it goes to other things as well. Types of Parkinson's diseases, while others are either unique or too or far prevalent for this disease. Sleep disorders in MSA are multifactorial and include nocturnal and diurnal. So I had to Google that word, basically getting up to go to urinate, to go pee. Manifestations. Nocturnal sleep is characterized by reduced sleep efficiency, fragmented sleep, and frequent awakenings, resulting in poor sleep quality. These disturbances are due to the neurodegeneration itself, linked to motor akinesia or rigidity and autonomic symptoms related to disease, but also to the presence of concomitant sleep motor or behavior disorders such as REM sleep behavior. So there's a few things that play into this, but it speaks from the beginning that the neurodegeneration itself, which is what MSA is all about. It's a neurodegenerative disease, right? It starts up here in the brain, unlike other ones that are nerves or muscles or other things like that. But there's other things that can go into this, right? REM sleep disorder, restless leg syndromes, periodic movements, and other sleep-related breathing disorders, right? So it says few studies. So this is looking into a few studies. I've read a few of these already. Spontaneous or levodopa-induced sleep attacks, but not confirmed. So they're just looking at the very beginnings of this. There's been a lot of studies on these sleep disorders, but not necessarily linked to MSA. So that's what they're looking at. It says RBD, which is REM behavior disorder, is a parasomnia characterized by loss of the psychological muscle atonia, not staying paralyzed during sleep. We are supposed to stay paralyzed during sleep so we do not act out our dreams, because that will be very bad. Somebody goes, grabs a knife, grabs a gun, sleepwalks, stuff like that is not very good. Sleep associated with complex, sometimes violent and dangerous motor behaviors during which patients act out the content of their dreams. And I got a video for you on that one. Although RBD is readily clinically suspected, medical video evidence is required to demonstrate REM sleep without atonia. The presence of RBD could be over or underestimated when based only on clinical history, right? So they got to see it. It's easy to go into the office and say, I talk at night, I kick and I fight. Do you really? I mean, do you really? So that's what it's saying. This video evidence is what's key. It says on one side, different sleep disorders may mimic RBD, obstructive sleep apnea, somnambulism, nocturnal epilepsy, hallucinations, confusional arousals, and RLS with a P. This is very confusing. And on the other side, a proportion of patients are unaware that there are abnormal behaviors during the night. So I'm clueless for most of my stuff because I take Seroquel at night for bipolar, and it really sedates me. It gives me good sleep, but it's a heavy drug. So this last paragraph, it says RBD is one of the most robust markers of an underlying alpha synucleinopathy, but its presence does not distinguish MSA from other alpha synuclein apathies like Parkinson's disease or dementia with Lewy bodies. Again, it is a go-to takeaway. If you see somebody with RBD, then it's like, oh, usually it's pointing towards Parkinsonian type diseases. Usually towards Parkinson's. I've read that it's straight to Parkinson's, right? But again, we're MSA and the Lewy bodies and these other diseases, dementia with Lewy bodies. These are atypical Parkinson's diseases. So it's all in the same category, right? It's not Parkinson's, but these categories are those deadly neurodegenerative diseases, basically. Right. So it says, moreover, RBD could predate the motor autonomic onset with these diseases, although a large corpus of literature documenting higher prevalence. RBD and MSA, few studies have systematically investigated prevalence of RBD as a mode for disease onset and its role in disease progression. Okay. That's a mouthful. Those 3 paragraphs are 5 minutes, 6 minutes long. That's a mouthful. Let me show you some videos. I got 4. I stitched them. And this is what we're up against here. So I'm going to try to be in my bed. I'm not going to show the wife or anything like that. I put some shadows down. Doing pretty good at this. Let me show you the first one. In this case, just watch my hands as I play it now. Snoring. And the hands. I got this crazy movement that I have. Now, I just want to say, as you keep watching these videos, that movement, those spasms, that's what I call spasms. That's what I have during the day. I have tremors, resting and action tremors, but this is spasms, right? Now, moving, how far do I go? Like, at what point does this constitute straight up RBD? Like, do I have to be attacking somebody? Okay, I got a video for that too. I got a video for that too, right? But this reminds me of these spasms. It's like yesterday, the last couple of days, over the weekend, yesterday, my spasms are just hitting. I'm driving home from work and my left leg just goes like this really hard, right? Nothing crazy, nothing dangerous, but these spasms come out of nowhere. So whether this is partial RBD, or just these spasms that we're still tracking down, what the heck they are, I have a feeling, I'm going to say this right now. I have a feeling these spasms, like you see right there, is the brain dying. And I don't know if I'm right or wrong, but that's neurodegenerative. I have a feeling this is the part of the brain that's dying slowly. And this is a side effect. I really do. Stuff that I've read, that my intuition, I've been pretty right recently. So those spasms that I have at nighttime, we go into the next video, right? This is me. Now, if you watch me from the beginning, I'll start twitching as well. Moving, right? Those aren't spasms to me. I'm trying to act out a dream, right? That one, I'm trying to act something out. You're not supposed to be moving when you're sleeping. You're supposed to be paralyzed. Like, people, I don't mind talking. I talk an awful lot. So I didn't put any videos of me talking. I had some crazy conversations. My wife could attest to that. Okay. This video right here, I'm trying to act something out. It only gets worse. So here goes another video after this one. Again, my hands are always moving, twitching. Just some weird stuff. Still moving. There you go, right? Just more movement. Now I think, is this the one where I go full tilt boogie attacking? It might be, right? So let me show you this one. I believe this is what RBD actually looks like. No clue what I was doing. I remember this dream perfectly though. I remember this one perfectly. I was swinging on somebody. I went left and right, and then trying to block a couple of swings from the person in front of me. I know this dream. I remember it. But waking up from it was just absolutely crazy. And that's all I remember waking up right there. I'm like, why am I grabbing my phone cord? And where's my phone at? So, pretty normal. Me and my highlighted hair, right? That's what RBD looks like. That is not supposed to happen. If you look behind me, the wife is not there for good reason. Okay. She has figured it out. I don't know how she's figured it out, but whenever I make certain gestures or speak or flinches, spasms, you'll see her in the video. She'll know to edge to the edge of the bed to get out of range of of the arms and fists, right? And she's not even in this bed at this point, so it's not funny, but it's hysterical how when you're married for so long, you know what's up, right? And we get to the last video. Watch my hands. Oops. Yeah, there you go. Right here. Right, that spasm. That's what I'm talking about. That spasm, I don't know what that's coming from, but that is just crazy, right? And it wakes me up. But that's what I'm talking about when it comes to these videos. You know, RBD is one of those things where who knows, and it's always it's a precursor of Parkinson's for sure, but it looks like it's a precursor to Parkinsonian diseases, atypical as well. I'm going to find out what that spasm is. Sometimes it happens dozens of times a day. Sometimes it's a couple. Sometimes it's the whole upper torso. I got a video where you guys saw me doing it live on a video. Sometimes it's the lower torso. It's the weirdest things in the world. I got a bad feeling about what that is, but you know, this is what RBD looks like. Again, I'm not showing you the little things, all this, the talking I do and the little gestures, and my hands always just moving and moving and moving. Like there's 2 videos of there where acting stuff out. And, you know, quite frankly, I'm tired of punching things in my life, you know, in my sleep. So, you know, if this video helps out, you know, it's here for you. So just a quick video. I know it's not terribly quick, but 12 minutes, and show you some insight on what this RBD looks like, and also some spasms. So I continue. Thank you for your support. You know, if you enjoy what I'm doing, trying to add to the community for MSA, like and support me, you know, with the subscribe, stuff like that, notifications. I appreciate it. We're getting views from around the country, and I appreciate it very much. So I'll see you guys in the next video. And the next one is probably going to be a sad video. I saw an ad. I saw a post on something on a Reddit or something like that from MSA community. It's sad. It hurts hard. So people that are going through this crazy disease, and I'm probably going to make a video right after this and show that one too. So stay with me, guys. We got a lot more to come. And any questions, let me know. But these videos are for you, they're for me, for those people after me, right? I'm going to post and do what I can while I have the effort and the energy. And in just about a week, I'm going to Mayo Clinic, right? I'm not hoping for miracles, but I am happy to progress and further clarify what I have and what I don't have, and make heads and tails of these spasms and these electrical neuropathy stuff that happens too. So love you guys to death. I'll see you in the next video. Take care. Goodbye.